This is Dr. Michael Ryan with Missouri Vein Care, talking about what I would call some of the myths of aging, and the way that pertains to what I do as a specialist is that people that come to me with a vein circulation problem come and they often say, I went to my provider, I went to my doctor, or they just decide on their own, I'm just getting older. My legs ache and throb, and I feel tired and run down, and I'm just getting older. And or the activities I do throughout the day are difficult. I have to take breaks, I have to rest, and that's part of getting older. And they just kind of concede that that's what's happening. What's really, I would say, unfortunate is that when people get to a point where they aren't able to do the things they're used to doing or want to do, I'm thinking, for example, of a patient who told me how bad she felt that her kids, who were very close to her, and her grandchildren were all going to go for a walk, and she felt so bad because she just couldn't keep up with them. She kept having to take a break because her legs hurt, and she felt terrible about it. She didn't feel part of the family, and not being part of a community of people is one of the most psychologically damaging and physically unhealthy things that you can do. So she really felt isolated from her family. So the aging process is, as I talk to people about it, is a steady process. You can't block it, you can't eliminate it. And I tell people that generally, it's kind of a slow decline, and sometimes you have a little bit of a, periodic dip, and then you continue at this steady decline. But it's not something that you'll notice dramatically from 1 month or 1 year to the next. And you should be able to do most activities that you used to do, maybe at a lower intensity or for shorter periods of time, but you shouldn't be restricted. For example, if you are an avid hiker, you should be able to hike until you're 100. You'll have to go slower, you'll have to avoid the steep hills, etc. You'll have to make adjustments, but you won't have to stop. What I see with vein conditions is that people actually have to stop what they're doing. That's not normal. And I remember talking to one of my nurses, and we were talking about this, that we heard this from patients so many times. I'm just getting older, or they had a whole host of other reasons. I'm on my feet all day, I'm working hard, I'm chasing after 3 kids, or I've got a difficult job, I'm working at it. And the nurse said she was talking to a patient when I heard her say, she said, it's not normal to feel exhausted and wiped out at the end of the day. It's not normal. And so that's when a light bulb went off in my head, when I realized, that is really true. And what can happen for most people is that they've had a hard day's work, and then they come home and they lay down for 10 minutes, and then they get a recovery burst of energy. They're now able to go for another couple of hours. People with a vein condition can't do that. They lay down, they sit down, and they are wiped. There's no restorative rest possible for them. So that is the difference between getting older and having a vein condition. As people get older, their overall capacity incrementally, which means each year a small amount decreases, but you're still able to do pretty much whatever you'd like to do throughout the day. You just have to be a little smarter about it. With a vein condition, you actually lose the ability to do certain activities. Could be walking, it could be working, it could be doing your house chores. And I can remember, for example, this was a strange description of a problem, but a patient, I said, what is the biggest thing you've noticed after vein treatments? And she said, I can stand now when I'm brushing my teeth in the evening. And I said, you can stand? Doesn't everyone stand? She said, no, I would have to go sit down and lay down in my bed while I was brushing my teeth in the evening because my legs hurt so badly. So this is the difference between normal aging and someone with a vein condition. And if you need help getting that sorted out, I recommend a vein screening, which is a free opportunity to do either an online self-assessment or in-person review with our staff. And it's easy to sort out after that with the use of a vein ultrasound to look at the abnormal veins, and then to try compression stockings, which I recommend to most people to try, because if the compression stockings help increase your energy level a little bit or reduce your symptoms, that is a confirmation that you have a vein problem that will also get better with treatment. So Dr. McElroy discussing what are the myths of aging and how do they relate to a vein condition.